Welcome back to our channel. Today we're exploring a significant study comparing CABG, or coronary artery bypass grafting, and PCI, or percutaneous coronary intervention, with second-generation drug-eluting stents for patients with multivessel coronary artery disease. We'll see how these two revascularization strategies stack up over the long term. Let's get into the findings from the BEST trial. The standard treatment for symptomatic multivessel coronary artery disease has traditionally been surgical revascularization with CABG. However, with advancements in PCI technology, especially second-generation drug-eluting stents, a contemporary comparison was needed. The BEST trial aimed to provide this comparison by evaluating the long-term outcomes of these two strategies. In the BEST trial, 880 patients with multivessel coronary artery disease were randomized to receive either PCI with second-generation drug-eluting stents or CABG. The primary outcome measured was a composite of death, non-fatal myocardial infarction, or target vessel revascularization. This randomization allowed for a direct comparison of the effectiveness of these two treatments. At a median follow-up of 4.6 years, PCI was associated with a 4.7% absolute increase in the primary outcome compared to CABG. This increase was driven mainly by a 3.3% higher rate of target vessel revascularization and a trend towards more non-fatal myocardial infarctions in the PCI group. These findings highlight the differences in long-term outcomes between the two treatments. Breaking it down, the primary composite outcome occurred in 15.3% of PCI patients versus 10.6% of those who underwent CABG. Specifically, target vessel revascularization rates were 7.1% for PCI compared to 3.8% for CABG, and non-fatal myocardial infarction rates showed a trend of 4.8% for PCI versus 2.7% for CABG. These detailed findings provide a clearer picture of the comparative effectiveness of the two treatments. A key finding was that CABG remained superior in reducing long-term adverse cardiovascular outcomes, primarily due to its durability and fewer spontaneous myocardial infarctions. This superiority underscores the long-term benefits of CABG for patients with multivessel coronary artery disease, making it a preferred option for many. Interestingly, the superiority of CABG was most evident in patients with diabetes, aligning with previous data suggesting CABG's benefit in diabetic populations. The treatment effect did not significantly vary with the syntax score, which measures the complexity of coronary artery disease, indicating CABG's consistent advantage across different levels of anatomic complexity. However, CABG was associated with a higher rate of TIMI major bleeding, 29.9% compared to 6.8% in the PCI group. Despite this, the overall safety outcome of death, myocardial infarction, or stroke showed no significant difference between the two groups. These safety outcomes are crucial for understanding the risks associated with each treatment. The results of the BEST trial underscore that CABG continues to be the preferred strategy for patients with multivessel coronary artery disease, especially in reducing the need for repeat procedures and spontaneous myocardial infarctions. While PCI with second-generation drug-eluting stents offers significant benefits, CABG's long-term outcomes make it a superior choice for many patients. Thanks for watching. Don't forget to like, share, and subscribe for more insights into cardiac care. Stay tuned for more updates on cardiovascular research and treatment strategies. See you next time!